I guess I can give a little bit of a historical perspective because I've been involved with different forms of presbyopia surgery for a while. In the old days, we started with the holmium laser, which is a form of laser thermal keratoplasty. And the problem in that procedure was that the energy levels were very high that were used, and the patients often had a tremendous amount of discomfort. And the discomfort was due to the fact that the eye became inflamed, and because the eye became inflamed, there was regression, and the procedure did not, the effects of the procedure did not last very long. And then we moved into the era of using a YAG laser called Presbyopic YAG laser surgery, and that was very invasive because that involved making grooves in the sclera, which is the white part of your eye, with the laser, and those patients actually did fairly well initially, but what determined the outcome really was the age of the patient. The older patients did far better than younger patients because older patients tend to have more rigid scleras, and the sclera plays an integral part during the process of accommodation, which is what you need in order to be able to read. And because it was so invasive, the eyes were often red for long periods of time, and so it sort of fell by the way. The excimer laser is now being used for the treatment of presbyopia. Specifically, I should say the excimer laser. I'm really meaning the femtosecond laser. But their results have actually not been as good as the results with optimal keratoplasty. Those patients see J5 at best in most cases, and those patients also suffer from the effect of halos and starburst at nighttime. The other problem, of course, is that the femtosecond laser is a $400,000 to $500,000 instrument, and so that puts it out of the hands of most surgeons. Excimer laser has been used by some people to treat presbyopia, but most of the algorithms that are used to date have not really been that successful or any better than J3 as well. And of course, when you do LASIK on a patient, that requires cutting often, and when you have cutting, you're always going to have flap issues, as is the case in about 6% of cases. LASIK, on the other hand, does not require any cutting, but is still much more invasive than optimal keratoplasty. So I think that this procedure really, compared to the others, has a tremendous advantage of, one, the cost of the procedure itself is much lower. The cost of the machine to the user or the ophthalmologist is much lower. The simplicity is far greater. The ease of use and the learning curve are far lower, and the side effects are virtually minimal, and the effectiveness is truly great. The only downside, if you can call it a downside, is the fact that the procedure may have to be repeated. But then again, as we age, our eyes become more farsighted with time anyway, and so we're always constantly changing our glasses to meet the needs of our reading abilities, depending upon what age we're at any point in time. So I said earlier that the procedure is like the Botox of presbyopia, and in a sense it is like that because it is repeatable, and it's predictable, and it's with minimal or no side effects.